Bonjour à tous et bienvenue à cette présentation sur GURI. My name is Arturo Vela. I'm a medical doctor and I'm an aesthetic cosmetic practitioner based in Mexico City. And today we're going to talk about GURI, which is the real anti-aging through collagenesis on the entire face. So GURI is a new type of liquid PCL injectable, which is fundamental for the anti-aging. So to understand more about the aging process, we have to understand all the changes that comes in the skin and also in the structure of the face. So we start with the bone structures. They suffer to this remodelation. We will have less density of bones. Also, the ligaments they have this increased laxity, and there's going to be increased tonus and rigidity of muscles. This has to do with the inner and the deeper layers. Then we have the fat deflection and increased laxity of skin. So we have here in this image the triangle of beauty of the triangle of youth. So we can see this inverted triangle will give us this beautiful and young look. And as we age, we'll have this inverted triangle as a normal triangle actually, and that's the the part that we can see in a beautiful and young face. Here's another example of the inverted triangle of youth. And here we have the fat redistribution. When we talk about the fat redistribution, we can see in this image that we have at 35, 45, and 55 years old, how the subcutaneous fat layers, they became, uh, they have these changes. So they can be moved, or they can have some kind of hypertrophia, but we can see that we have less and less and less subcutaneous fat compartments. So we have two subcutaneous fat compartments, the ones that are the superficial and the deep ones. And the superficials are the ones that change with the weight changes. And the inner ones, or the non-superficials, they are the only ones that change with age, and they have this redistribution. So to understand this, we have the collagen. We have that the collagen is a fiber, and it has its small fibers, and these small fibers they will have this triple helix structure alongside with the amino acids. And these collagen fibers, they will have and they will suffer these changes through the years. So the collagen is a structural protein. We have 28 types of collagen, but the most important ones are the collagen type 1 and the collagen type 3. So the collagen type 1 is the most abundant in the skin. Also, we have it in muscles, we have it in bones, we have it in some other organs. But in the skin, it's very abundant, and it comes and it has 85 to 90%. Then we have the collagen type 3, which has the which is 10 to 15%, but it's not a mature collagen. This collagen type 3, it's the type of collagen that we start building through an inflammatory process such as scar process. So when we turn 25 years old, we start the decrease of collagen. And this decrease comes at 1.5 per year, and it's affected by many factors, such as genetics, and the principal ones are the factors that we have outside, the factors such as sun exposure or pollution also, and also the lifestyle, such as how we feed, uh, if we drink or we smoke, it's also being affected by collagen. So the collagen is produced by fibroblasts, and in this image we have also these three stages and how we see the collagen alongside with the elastin, that these two proteins will have this uh, like a mortar and brick. So we'll give a structure and we have a real nice proportion. But through the aging process, through the changes in age, we will have that this structure will become very um, the structure will change and the proportions. So instead of having lots of collagen, we'll have less collagen. And instead of having a beautiful structured collagen, we'll have this non that beautiful structure in collagen. And also, part of this has to do with the hyaluronic acid that also will give us this hydration in the skin. So, the collagen in this image, we have the fibroblasts, the collagen fibers, and the elastin fibers, and how they will give this structure, firmness, and elasticity to the skin. So here an image and remind how this triangle of you, this collagen, will be reduced through the years. And I picked this example of this beautiful and talented actress that she is still beautiful, but we can see the changes through the years. So what is Goody? Well, Goody is the first type of liquid PCL injectable. So the polycaprolactone, it's a sorry, first here. So it's a premium collagen stimulator, Goody. When we talk about a premium, we talk about this liquid form of PCL. We don't have to see the carboxymethyl cellulose in this product. So it's total liquid, fully solubilized, and having these characteristics will spread to the skin. And we'll talk more about this, but we know that this PCL it's premium because that's the main characteristic that it's fully solubilized form of PCL. So the polycaprolactone it's it becomes with the needings of anti-aging, with the production of collagen, and having this biodegradable polyester it comes with some characteristics such as the PCL is bioabsorbable in the skin, it's biodegradable and biocompatible. And the main characteristic is that it's non-toxic for to the human body. So, and how we get rid of this collagen? We know that this product, Goody, the PCL, fully solubilized, will stay in the skin for 1 year, sometimes more than that, but will be bioabsorbable through the hydrolysis, which in contact with the water will go through these changes in the lungs, and it will become CO2 on oxygen, and will be absorbable on the body. So, what makes us different, what makes Goody different, and it has a unique technology that it's called CESABP. So, this means collagenesis enables solubilized active biodegradable polymer. So, with this technology, this solubilized polymer will spread on the skin, on the entire skin, and also that is that characteristic of being solubilized, and will spray in the entire skin and will give us this liquid facelift, as they call it. So the mechanism of action has to do a lot of with the neocollagenesis. So when we inject Goody, we have to inject it in the subcutaneous compartments. And when we inject it, Goody will smoothly spread into the skin. When it comes to the skin, it will spread, and as it comes in a liquid form, will create this 3D matrix that this web of Goody of PCL form solubilized will stimulate the fibroblasts. And stimulating the fibroblasts will create new collagen and will improve the skin elasticity and will give us this final result, which is the facial lifting. So here is an image of a competitor or other brands in the market that they have these microparticles and they have to be injected with 26, 27 gauge needles, and they have the polymer, the PCL microparticle, also with a carrier. With Goody, we're different. We have this fully solubilized form of PCL that we don't need to have any carrier. We don't need to be a microparticle between 25 to 50 micro micro size. So this fully solubilized form of PCL will create this 3D matrix, and creating this 3D matrix will spread into the skin. So here's an image of histological cuts of the changes of the skin thickness. And here's the control at the left, and then we have Goody on the right at 1, 2, 4, and 6 weeks. And we can see how the collagen and the subcutaneous layer will change and will give this thickness to the skin. So Gorgeous Goody comes in a beautiful box, as you can see, and a pre-filled syringe. So we have that it comes in a white liquid because of the characteristics of the PCL, and it's very ergonomic, very easy to use. There's no complication with the injection. And other thing that it's very important to this is that we can inject it with 30 needle gauge needle. So because it comes liquid. And when we talk about Goody and how to inject it, we have to be very conscious about where we can inject it. So Goody can be injected under the eyes, which is a very great characteristic because with other polymers, we cannot inject under the eyes and we cannot inject in the forehead. So with Goody, we can inject under the eyes, and this is the protocol that we have, and we can inject uh, 1 point, 2 points in the forehead, 2 centimeters above the eyebrows in the mid pupillary line, and we inject zero point 0.2 cc's of the product. Then we can go to the under eye area, also 1.5 to 2 centimeters next to the canthus and also below the mid pupillary line. And here we also inject zero point 0.2 cc's. So this will spread. It won't stay in the place where you inject it. That's another uh, great characteristic of Goody because we are giving volume, but not at the moment. We're giving volume through the process of new collagen. Then we have the mid-phase protocol where we inject 3 points, as you can see in the cheeks, and you go in this part around, sorry, and you go and put 3 points of each one of them, zero point 0.2 cc's per point, and make this inverted triangle, the youth of triangle, to inject Goody. So that's the protocol, and as I said, you have to inject it in a subcutaneous in a subcutaneous layer. The technique has to be with 30 gauge needle, and you can go between 45 to 90 degrees. It all depends in each characteristic of your patient. So as I said, the application part, we don't need multiple injection points. We only need 5 per side or 10 in a whole face. Uh, we don't need to shape the application. This is not a hyaluronic acid filler, so we don't have to give this uh, form and sculpture to the face. It will act by itself. And the soft massage is enough up to the application. We don't have to be very encouraged to massage, just something very soft. Uh, it's needed. So the protocol, we recommend three applications every four weeks interval. And so after these three applications, we can give another one or two more applications. But it all depends in every patient conditions. At the end, you have to individualize all your patients. But for a natural or an easy patient, we just give three applications every 4 weeks. But if there's a saggy, very old face, we have to give another one or probably another one after 3 to 6 months. So the indications for GOURI, it's for everyone. So GOURI, it's fundamental for the care through the entire face rejuvenation. And as we said, it's the first liquid type of injectable of PCL form. And we indicated when you start losing collagen. So when we don't have to use GOURI, so it's very important to know if you are allergic to some of the compounds. The main compound of GOURI it's PCL. So if you're allergic to PCL, so that's not an indication. Also, we have to avoid GOURI when there's an active skin condition, such a bacterial or fungus or some other infection or other active reaction that you have in the face, in the skin. So that's another contraindication. And it's not recommendable when you are pregnant or you are under lactation as many other injectable products, and when you have some uncontrolled metabolic disorders such as diabetes. And also, we have to be very careful with the autoimmune disease such as lupus. When they are in their active form, we cannot use GOURI. If there's an autoimmune disease that is controlled, okay, go ahead and just be very careful and in how to use the product. So just to finish with the cases, with the presentation, we will give you some medical cases that we have been walking through with GOURI. So this is one of my cases, and you can see the before and after treatment, left to right. And here it's this patient with 3 sessions at 4 weeks interval. So we can notice here in the cheekbone area or the malar area how the structure it's very soft, the skin quality it's better, and you can see the structure that it comes very natural and how uh, the triangle of youth it's becoming inverted. So you see in the first image how the triangle gave him this square face, and then you have this beautiful inverted triangle face. And you can see also on the nasolabial folds how it's been acted and how it looks less and less. Here's another example of one of my cases, and you can see also here uh, the inverted triangle. You can see that the cheeks are more high, and this is before and after 2 sessions only at 2 weeks interval. So we have a really nice um, result in this one. In this picture, it's beautiful because I really like it because you can see in the first image in the left one in the before treatment how the face looks so saggy. The skin quality is not that good. And you can see in the second picture in the after treatment how the patient has these higher cheeks and the skin quality looks so good. I know you can still see, which is very noticeable, the nasolabial folds, but that's so genetic. But you can see in the entire face how she looks so the structure how the structure has changed. Here's another example of the same patient, and you can see the higher cheeks. And we have here another case of this patient after 2 sessions in 2 weeks. And again, you can see the cheeks. It's very noticeable. And I know she has a square face structure, but here we can see the inverted triangle too in this image. This is a beautiful case that I really, really like, and it's you can see the skin quality. Yeah, it's been 4 sessions. It's been one session after the other one with 1 month interval, but you can see here the skin quality how has changed and how it's been given a lot of structure in the cheek. And Goody acts in memory with the collagen. So Goody doesn't create extra collagen. Goody creates your own collagen, the collagen that you used to have. And here's another case. Or here's another case by Dr. Young. And we have here after 12 weeks, 3 months, it's only one session. Yeah, it's been combined with hyaluronic acid, HA, but you can see how the wrinkles have disappeared and how the skin quality has been improved. And in the second image, you can see also all the improvements that this patient has had. So, merci beaucoup. Thank you so much. I'm so here are my social media. If you have any other further question, you have a protocol that you want to recommend, be free to write me. And thank you so much, AMWC. Congratulations for this Congress, and I wish you the best. Thank you.